Does any of this sound familiar? You know, that feeling that your gut is just completely unpredictable. One day everything's fine, and the next you're dealing with pain, bloating, or you're just making a mad dash for the bathroom. It can be so disruptive and honestly pretty isolating. But the thing is, it's also incredibly common.
Get this, it's estimated that a staggering 10 to 15% of adults right here in the US are living with IBS. That is a huge number of people. So the most important thing to take away from this, if you're going through this, you are so far from being alone.
So what exactly is IBS anyway? To really get it, we've got to move past the idea that it's just a sensitive stomach or something you just have to live with. It's a real, recognized medical condition with a proper definition.
Okay, so officially, IBS is a chronic, meaning long-term, condition that messes with your digestive system. Now, a really key point here is that it's not a disease that actually damages your gut tissue. Instead, it's a collection of symptoms that can come and go. And even though it is chronic, the good news is that it is absolutely manageable.
So let's talk about the specific signals your body might be sending you. Understanding the symptoms is always the first step, and it's also how we can start to figure out which type of IBS a person might be dealing with.
All right, the core symptoms usually include abdominal pain, which is often tied to your bowel movements, along with that lovely gas and bloating. And then you have the changes in bathroom habits. For some people, it's all about diarrhea. For others, it's constipation. And for some, it's a frustrating swing back and forth between the two. These usually happen in what doctors call flare-ups, so they can come and go.
What's really interesting is that IBS gets broken down into 3 main types, and it's all based on your main symptom. You've got IBS-C for constipation, IBS-D for diarrhea, and IBS-M for a mix of both. And knowing your type is so important, because the treatments are often tailored specifically to each one.
So this brings us to the biggest question of them all, right? What is actually causing all of this? Well, researchers don't have one single simple answer, but they have a really fascinating theory, and it all comes down to a communication breakdown between your gut and your brain.
And this is where things get really interesting. IBS is now officially classified as a disorder of gut-brain interaction. This is a huge deal. It validates what so many people have felt for years. It's not all in your head. It's a real physical problem with that super complex communication highway that connects your digestive system to your brain. Okay, so a big piece of this communication puzzle is something called dysmotility. Basically, it just means the muscle contractions in your intestines are out of whack. Maybe they're moving too fast, which leads to diarrhea, or they're way too slow, causing constipation. And for a lot of people with IBS, the colon muscle just contracts more intensely, and that's what causes those really painful cramps.
Then there's the other key piece, visceral hypersensitivity. The best way to think about this is that the volume knob on the pain signals coming from your gut is turned all the way up to 11. The nerves are just extra sensitive. So normal digestive stuff that most people wouldn't even notice can feel really painful for you.
And the story doesn't even stop there. Other things can play a role too, like an imbalance in your gut bacteria, having a bad stomach bug in the past, certain food intolerances, and even high levels of stress during childhood, which can actually shape that gut-brain connection from a very early age.
Okay, so with all these things potentially going on, how does a doctor actually land on a diagnosis of IBS? Well, the process is actually pretty logical, and it's all about getting a really clear picture of what's happening with you. It all starts with a deep dive into your symptoms and your medical history. And since there's no single IBS test, a huge part of the diagnosis is actually a process of elimination, ruling out other things that can cause similar symptoms, like celiac disease or inflammatory bowel disease. Your doctor might run some tests, but it's mainly to make sure nothing else is going on.
All right, now for the part we've all been waiting for. What can you actually do about it? Living with IBS is all about management, and believe me, there are so many effective strategies you can use to start taking back control.
A lot of times it starts with food. Simple changes like slowly adding more fiber or avoiding common triggers like dairy or gluten, they can make a massive difference. And keeping a food diary can be your absolute best friend for figuring out your personal triggers. A lot of people also have great success with something called the low FODMAP diet, which is a plan that helps you pinpoint certain types of carbs that are tough to digest.
Your lifestyle plays a huge part too. Regular and moderate exercise is fantastic for your digestion. And since we know stress is a major trigger, things like meditation or yoga can directly help calm down that overactive gut-brain connection. And hey, never ever underestimate the power of a good night's sleep.
And there are plenty of medical tools in the toolbox as well. Therapies like CBT can actually help you change how you respond to stress.
There are also specific medications to target constipation or diarrhea, and even certain antidepressants in really low doses can help calm down gut pain. Probiotics can also be a big help for some people in getting their gut bacteria back in balance.
So what does the future look like when you have IBS? I've got to tell you, the outlook is genuinely hopeful, and there are a couple of really key things I want to make sure you hear.
And this might be the most important reassurance of all. Having IBS does not increase your risk for more serious diseases like Crohn's, colitis, or colon cancer. It can feel awful, for sure, but the condition itself does not physically damage your intestines. That is huge.
Look, managing IBS is a journey. It's going to take some trial and error to figure out your unique triggers and the perfect mix of strategies that works for you. But the most important thing to remember is that with a little patience, almost everyone can find a treatment plan that brings real, significant relief.
So let's end on a question for you. Maybe it's starting that food diary we talked about. Maybe it's trying a 5-minute meditation, or just scheduling a short walk after dinner. What is one small, doable step you can take today to start listening to your body's signals and begin that journey toward feeling better?